is what is your plan for reducing healthcare costs for individuals and families? And then also, how do you propose decreasing medical costs overall for our nation?
Yeah. Well, you know, half of our bankruptcies are now medically related, as happened with your sister. And I can tell you, when I've gone door to door for candidates all over the state in my role as a Democratic leader, I would always ask a question on the door: what is the issue that concerns you most? And during the last 4 years, up until this recent financial crisis, the answer was healthcare, because families who have healthcare are worried about losing it, and those without it, or making the co-pays, or so forth as you're facing. And those without are simply worried about getting sick, or they're sick and how to pay to get well. And I think we need to have a plan that fills in between the existing plans, that breaks the cycle, the downward spiral, in which people without health care wait to an advanced state of disease. They go to the emergency room. The costs are the most expensive way to treat a disease. Those costs get transferred onto those with health care. The price of health care goes up. And then employers are pushing to either drop the health care altogether, or to push a big share of it onto the worker, which often workers cannot opt in and can't afford to do. And the whole price goes up, and then we repeat the cycle. And that downward cycle has to be broken. So I believe we need to have a plan that fills in so that those currently without insurance can have an affordable plan, including the ability for employers who do not provide health care to pitch some pennies into the pot to help with that, and premiums adjusted to people's ability to pay. And I think we have to invest in prevention. We have to invest in disease management. Part of this effort on prevention needs to include more in clinics, because they're the most cost-effective front door to the healthcare system. And we need to emphasize some of the strategies that Governor Kitzhaber talks about in terms of evidence-based medicine pathways that do the maximum amount possible for the dollar. We're spending 18% of our gross domestic product in this area. So we're spending a lot of money, more than any other nation. Europe's spending 10%. So we've got to become more efficient. And I tell you, I'm really concerned about what lies down the path here, because we're going to have a tremendous retirement of baby boomers. They're going to need a lot more medical care, and we're going to lose some of our doctors and nurse practitioners and nurses who are also retiring. So more higher demand and maybe lower supply. And so these are things we've got to push forward together with a national vision for that affordable, accessible, cost-effective system.
Thank you very much.
Less complex issues we face: Social Security, Medicare. That's something quite different. That's a challenge that's facing us in a much more trust fund that's in much deeper trouble. But then on the pension front, we have companies that made it. Smith voted to make it easier for companies to declare bankruptcy, throw off their pension responsibilities. The pension insurance fund is going to go bankrupt and be unable to cover the pensions even at their reduced level. And so that is a serious, serious problem. I can't tell you, if I've been doing this 100-town tour for change, how many times I've run into somebody who said, thank goodness my pension was with the union, not with the company, or I'd be out of luck. And just down at a pulp and paper mill group that is on strike down in Halsey, and this was the point that they were making. They were just thanking their lucky stars that their pension was through their union, and wasn't going into wasn't being ditched, if you will, couldn't be ditched by the company. So all three elements are important, and I think you have an advocate for the bottom line corporate profits. You're going to have somebody who seeks to minimize what workers have earned. If you have somebody fighting for our families, you're going to, like I am, you're going to have someone who is fighting for fairness in the pension law. And we should require companies to honor the pension responsibilities that they incurred along the way. It was part of the bargaining process. It's part of what's been earned, and for companies to be able to easily ditch it is outrageous and adding to. But one is to create a national nursing institute that would work on this issue of improving and increasing capacity and training, because our healthcare system needs to have a national strategy to greatly expand training opportunities, and also to address some of the work conditions where nurses end up in basically in such an intense number of patients per person that they burn out. If they burn out, then somebody who might have worked 5 days a week starts working 1 or 2 days a week because they simply, the workload is beyond capacity. And so there's issues of that nature that need to be taken on. Now, by the way, there is no senator currently in the U.S. Senate who has a partner as a nurse. And I get stories from the front line on healthcare through Mary every single day. So I think it's time to rectify that and have a senator with a wife as a nurse. Now, you mentioned a broader issue on education here. I just want to note that we are now the first generation of adults in which our children are getting less education than we got. And that is because the cost of going to two-year training school, to an apprenticeship program, to a college are all just soaring in proportion to what people earn. And in fact, the numbers you were mentioning, I'm not sure if you mentioned these numbers or not, but in the last 8 years, the cost proportional to of going to college has gone up enormously. And that then means students go for a semester and drop out to try to earn more money. And the odds of getting through the program, they get maybe halfway through, 2/3 of the way through, but finally decide they just can't afford to get it done, or the debts, they're having a hard time meeting the debt payments as they are, etc. So we did something about this at the state level. We doubled our opportunity grants for our students to go to college. The response was very, very strong, and at the last e-board last week, emergency board, we allocated, the only large chunk of money we allocated was $4 million to additional scholarships to help people go to school. But we need a federal partner. We need the U.S. government to be diving in with Pell grants and low interest loans to assist. Otherwise, if we don't have a good education system today, we don't have a strong economy tomorrow, and that is down the road. So a lot of work to do on that front. This is why with NAFTA and CAFTA the same principle applies, with no labor rules, no environmental rules, any effort to enforce them. The manufacturers are going overseas. And that just means we won't be building anything in America. And what you're seeing on the docks is a reflection of that. If we're not building anything, we lose our middle class in America. And now for folks who are advocating for maximum profits for the biggest and most powerful corporations, they may see their profits soar. But my vision of America isn't a few wealthy and everybody else struggling at the bottom. My vision is that we have a large middle class with families have the ability to raise their children, have the opportunity for their family to thrive, for children to live to their potential, that we invest in education, we invest in health care, we invest in our infrastructure so that we'll have a strong economy for the next generation. And so these trade deals, as the saying goes, they may call it free trade, but there's nothing free.
Providence is one of those employees that is knocked back their pension benefits. And I'm helping Portland nurses, which is where Jeff Merkley's wife works, with their bargaining proposals. And we have the worst, Providence has the worst retirement in the city as far as employers of nurses in hospitals. And they're the richest in our state. Purse. Anyway.
I felt very encouraged that he answered my questions about education with a long-term picture instead of a short-term corporate profit picture, which seems to be the one his opponent has. You know, he understands how these different systems tie together and that things have to be supported at many levels in order for our economy to work for our people.
And one of the things I thought was good, I thought he was about to stop, and then he started talking about preventive care, and that's really going to be the essential thing to increase the health of our population going forward, and that's why other countries have healthier workforces, healthier our population in general, longer life expectancies, better infant mortality rates, is because they actually have preventive care as part of their basic right as a citizzen. Just for that.